Hemorrhoids are swollen blood vessels in the lower rectum and are probably the most common cause for rectal bleeding. Hemorrhoidal venous plexus are normal anatomical structures present in all individuals. Due to their rich vascular supply and highly sensitive location, these venous plexuses tend to engorge and prolapse. Hemorrhoids are classified as external and internal by their anatomic origin within the anal canal and by their position relative to the dentate line. External hemorrhoids are located below the dentate line. They develop from embryonic ectoderm and are innervated by cutaneous nerves that supply the perianal area, including the pudendal nerve and the sacral plexus. By contrast, internal hemorrhoids are located above the dentate line. They arise from embryonic endoderm and are not innervated by somatic sensory nerves, thus, they do not cause pain. Internal hemorrhoids are further categorized into 4 grades. Grade 1 hemorrhoids project into the anal canal. They often bleed but do not prolapse. Grade 2 hemorrhoids may protrude beyond the anal verge with straining or defecation but reduce spontaneously when straining is stopped. Grade 3 hemorrhoids protrude spontaneously and they require manual reduction. Grade 4 hemorrhoids chronically prolapse and cannot be reduced. Hemorrhoids usually cause symptoms when they become enlarged, inflamed, thrombosed, or prolapsed. Most symptoms arise from enlarged internal hemorrhoids. The engorged anal mucosa is easily traumatized, leading to rectal bleeding that is typically bright red due to high blood oxygen content within the arteriovenous anastomosis. Prolapse leads to soiling and mucus discharge and predisposes to incarceration and strangulation. Hemorrhoids mainly occur in conditions where the intra-abdominal pressure is increased. Some of these conditions include straining and constipation, pregnancy, and portal hypertension in advanced liver disease. Other risk factors include family history of hemorrhoids, lack of erect posture, chronic diarrhea, colorectal cancer, rectal surgery, obesity, spinal cord injury, episiotomy during vaginal delivery, anal intercourse, and inflammatory bowel disease. The most common symptom of hemorrhoids is painless rectal bleeding. The blood is usually bright red in color and may drip, squirt, or appear as streaks on the toilet paper or stools. Sometimes, pruritus may also be present. Patients may also complain of a painless lump in the perianal area, especially in grade 3 and 4 hemorrhoids. A patient with a thrombosed external hemorrhoid may present with an acutely painful mass in the perianal region. Additionally, there may be a history of constipation. If there is chronic rectal bleeding, patients may also have symptoms of anemia, including fatigue, shortness of breath, and muscle cramps. Other complications include ulceration of the perianal region and strangulation of hemorrhoids. Grade 3 and 4 hemorrhoids can easily be diagnosed by inspection of the perianal region and a digital rectal examination. However, a proctoscopy should be done when grade 1 and 2 hemorrhoids are suspected. A full blood count is useful to identify anemia. For grade 1 and 2 internal hemorrhoids and non-thrombosed external hemorrhoids, conservative therapy and medical management are the preferred treatment options. These include warm sitz baths 2 to 3 times a day, high-fiber diet, adequate water intake, adequate analgesia, and stool softeners. Rubber band ligation and sclerotherapy are some non-surgical treatment options. Surgical hemorrhoidectomy is the most effective treatment option for hemorrhoids in many patients.